Welcome to this explainer. It's designed to really sharpen your skills for that big phlebotomy certification exam. We're going to break down the most critical knowledge you need, not just to pass, but to be a truly safe and competent professional out there. So here's our game plan. First, we're going to cover the absolute non-negotiable safety rules you have to know. Then we'll dive into how to adapt your technique for our youngest patients and our oldest. After that, we'll tackle how to troubleshoot those tricky draws, and we'll wrap it all up with a rapid-fire review of the key facts you'll need for your exam. All right, first things first, let's talk about the big mistakes, the ones with zero tolerance. These are the errors that can not only fail you on the spot during your exam, but way more importantly, could actually put a patient in real danger. So you'll want to pay close attention here, because these are non-negotiables. Okay, these are the rules you just can't bend. Mastering this section, well, it's the bedrock of your entire practice. There are absolutely no exceptions, and they are critical for keeping patients safe and for passing that certification exam. Misidentification is probably the biggest mistake you can make in phlebotomy. This three-step process is mandatory every single time with every single patient. You ask, you compare, and then you label everything right there at the bedside before you even think about walking away. This is what prevents wrong patient results, which, as you can imagine, can lead to some really terrible outcomes. This one little rule prevents major errors before they can even start. See, leaving a tourniquet on for more than 60 seconds causes something called hemoconcentration. Just picture a traffic jam in the blood vessel. Plasma starts to leak out, and the blood cells get all bunched up. This can totally throw off test values, like potassium, which might lead a doctor to a wrong diagnosis. So sticking to that 1-minute rule, that's how you guarantee your sample is accurate. This needs to become pure muscle memory for you. The instant that needle comes out of the patient's arm, your very first move is to click that safety device into place. Your second move, put it straight into a designated sharps container. No exceptions, and you never, ever recap a used needle. All right, let's shift gears and talk about pediatrics. Working with kids is a totally unique challenge, right? It's not just about your technical skill, it's about communication and compassion. That's what makes the draw safe and successful for everyone involved. Just remember, you are not alone in that room. The parent or caregiver is your #1 ally, so get them involved. Ask them to help explain what's happening, to comfort and to hold the child. When you create this calm, team-based environment, it dramatically reduces the child's anxiety and movement, and that directly improves your chances of getting a successful stick on the very first try. Yeah, one size definitely does not fit all here. Your approach has to change with the child's age. For toddlers, simple directions and fun distractions are your best friends. But for teenagers, it's all about respecting their privacy and giving them a sense of control. Tailoring your communication like this is the key to preventing any sudden moves that could cause an injury or, ruin the sample. This is such a great phrase to remember for therapeutic holding. If a child needs to be held still for safety, the goal is always gentle support, never restriction. The hold should be minimal, you should constantly be checking in on their comfort and safety, and it should never, ever be forceful. It's about helping, not restraining. Now, let's turn our attention to our geriatric patients. With this group, a really careful pre-draw assessment is absolutely essential. The changes that come with aging, things like fragile skin and those tricky rolling veins, mean you have to adapt your entire approach. Think of this 4-step process as your blueprint for success. First, you look and you ask, what's the skin like? Are they on blood thinners? Second, you choose the right tools for the job, maybe a winged set or smaller tubes. Third, you anchor that vein firmly from below to keep it from wiggling away. And finally, you pop that tourniquet off as soon as you see blood flow to minimize pressure on those fragile vessels. Okay, this is pure gold for your exam. These are exactly the kinds of specific details they love to ask about. For a PT/INR, that blue top tube has to be filled right to the line. For a TSH, you should always ask about biotin supplements because they can really mess with the results. And for a BMP, just gently remind your patient not to pump their fist. That can falsely raise their potassium. These little details make a huge difference. All of these techniques are designed to prevent bruising and skin tears. So cleanse gently, go in at a shallower angle, hold pressure a little longer to make sure everything's clotted off, and try to use a self-adhering wrap instead of tape that can rip that delicate skin. Every single step is about protecting your patient. Sooner or later, it happens to all of us. You perform a picture-perfect stick, but nothing
no blood flow. What you do next is a real test of your skill and professionalism. So let's walk through the correct and safe way to handle a no-flow situation.
When you get no blood, your first instinct should not be to move that needle around. Stop. The very first thing you do is check your equipment. Is the tube pushed all the way in? If it is, try a new tube. The first one could have lost its vacuum. Only after you've checked those two things should you even consider making a tiny, minimal adjustment to the needle's position. Whatever you do, don't blindly probe or fish for the vein. That's unsafe and just unprofessional.
Burn this ratio into your brain, 9:1. 9 parts blood to 1 part anticoagulant. This is the super precise, required ratio for any coagulation tests you collect in that light blue top tube. It's not a suggestion, it's a strict requirement to get an accurate result. And this is exactly why that 9:1 ratio is so non-negotiable. If you underfill that tube, you have way too much additive for the amount of blood. The test result will be wrong, the lab will reject the sample, and you'll have to stick the patient all over again. Getting it right the first time is just so much better for everyone. All right, we've covered the rules, the special populations, and how to troubleshoot. Now let's just boil it all down into a final, high-yield summary of the absolute must-knows for your exam. Seriously, if you walk into your exam knowing nothing else, know these 5 rules cold. 2 identifiers and bedside labeling every single time. Tourniquet on for less than a minute. Blue tops filled right to the line. No recapping ever. And for no flow draw, check your equipment before you even think about moving that needle. These 5 principles are the absolute core of safe phlebotomy, and I guarantee they'll be central to your test. At the end of the day, every single rule, every technique, and every bit of knowledge we've talked about today is designed to do one thing: keep your patient safe. That is your #1 job. Carry that principle with you into your exam and into your career, and you will absolutely succeed.